President Duterte received his first dose of COVID-19 vaccine from Chinese company Sinopharm last night. This is supposedly upon his doctor's recommendations. It was Health Secretary Francisco Duque who administered the shot. Sinopharm does not have a permission for emergency use in the Philippines and was only allowed for limited use of the Presidential Security Group under what's called a compassionate special permit. Let's get more clarification from our Caroline Bonquin. Caroline, Sinopharm is one of the most expensive vaccines. Is that right? And how different is this from other brands in terms of efficacy?
Well, if you'd ask Food and Drug Administration Director General Eric Domingo, Sinopharm is almost similar to Sinovac. They both use inactivated virus to trigger immune response and have an almost similar efficacy. But again, the vaccine experts and the FDA have not yet reviewed Sinopharm. They haven't seen any official document about this vaccine. What Domingo said was just based on the evaluation made in other countries.
What I've read sa mga ibang evaluation niya, like sa WHO, similar din naman yung efficacy niya sa Sinovac, especially sa mga 18 to 59-year-olds at saka sa mga walang comorbids, no? Mataas din naman, mga 70 to 80%. Tapos yung safety profile niya, wala rin namang nakikita mga very important safety issues dito sa Sinopharm. But like I've said, wala pa kasing nagsubmit sa amin dito ng actual documents, no, ng regarding the manufacturing and regarding the clinical trials. Kaya hindi rin naman ko pa nababasa ng hindi pa namin nakikita or na-evaluate very in-depth.
The PSG hospital, under a compassionate special permit, received 1,000 doses of Sinopharm for the president's close-in security and their close contacts. But vaccines or drugs under a special permit like Sinopharm do not go through rigorous evaluation checks by the FDA.
Compassionate special permit kasi talagang walang evaluation yan or walang pinagdadaanan na evaluation sa FDA. So when we give a compassionate special permit, it is very clear, no, na wala tayong assurance ng safety, ng efficacy, tsaka ng quality kasi hindi siya i-evaluate ng FDA.
Back in February, when Sinovac was arriving into the country, the palace said that the president preferred Sinopharm. Last night, Malacanang said that this was what doctors recommended to the president, and as of this afternoon, the presidential spokesperson said that President Duterte has not yet experienced any side effect from the vaccine. Pia.
Caroline, the president's chief legal counsel, Sal Panelo, also got vaccinated with Sinopharm. Is the FDA aware about who else got this vaccine, and is that allowed under the compassionate special permit?
Director Domingo said that the special permit covers the president, his close-in security, and their close contacts. And it's actually up to the director of the PSG hospital to choose who will get the vaccine. But they have to tell the FDA, they have to inform the FDA if they will give this vaccine to the other close contacts of the president. As of this afternoon, the FDA said that it is not aware when the vaccines arrived and who else who got inoculated with it. Domingo said that he already wrote to the PSG hospital asking them to send a list of the individuals who got the Sinopharm vaccine and also to report any monitored side effects. Pia.
Now, Caroline, speaking of the PSG, wasn't there an investigation late last year, no, after members of the PSG got vaccinated with this Sinopharm, no, this so-called illegal vaccination? What happened to that investigation?
Well, it's been 4 months and the investigation hasn't gone anywhere. Director Domingo admits that it seems like they've hit the wall. They tried to check how the vaccines were shipped into the country. They also sent a letter to the PSG, but they did not get any information. Domingo said that they are actually in a difficult situation and that is why this remains an open case. Pia.
Caroline Bonquin, they're reporting.